Now, we do have a special ongoing segment on the Jubilee anniversary 1 year on. Let's go to that now. The Jubilee government did promise to offer quality and affordable healthcare to all.
However, a year later, many questions still remain about access to healthcare for ordinary Kenyans. Karonderi has that report on the Jubilee scorecard.
As with every promise made, one has to be held accountable, and the spotlight is now on the Jubilee government a year later. During the colourful launch of its manifesto, quality and accessible healthcare for all was a mantra that the Jubilee government promised to live by if elected to power. A year later, does the promise hold? The abolition of the maternity fee is considered a plus for the government, as more women can now access free maternity care. So much so that recently in Taita Taveta, it was reported that women were crossing the border from Tanzania to deliver their babies in Kenya, where it would cost them nothing to do so. And while free maternity care is a step in the right direction, those in the sector feel this does not quite scratch the surface. Kamau Gatweshi has been in the health sector for over a decade and feels more should be done to tie the loose ends.
We are not seeing a deliberate attempt from this government to actually ensure that we have more nurses offering these services.
In a campaign spearheaded by the First Lady Margaret Kenyatta, dubbed Beyond Zero, quality maternal care taken as a vision that can be accomplished. Corporates, Standard Group included, had by last week raised over 44 million Kenya shillings to go to the Beyond Zero campaign. Recently, 2 public hospitals were in the limelight for the wrong reasons. The unfortunate incident of a woman delivering on the floor at the Bungoma District Hospital is still fresh in people's minds. So is the more recent one of a mother who lost her baby in January at the Nyeri Provincial General Hospital. The baby allegedly fell from the womb to the floor during labor. The hospital's medical superintendent had attributed the problem to a shortage of personnel. The devolution of health services has not been appealing to some, as evidenced by the recent strike of medics, with others saying it is a welcome move that will inject new life into the health sector.
Improving health is one of the functions that will benefit the ordinary citizen.
The promise of affordable health care is still a pipe dream to many Kenyans who earn low incomes.
Upande wa X-ray, upande wa CT scan, iweze kuleta hiyo mashini na pia kuongeza wahudumu.
So is the access to facilities. Diagnosed cases of cancer being on the rise, but facilities that offer treatment such as chemotherapy and radiotherapy are not accessible to many.
Sasa mtu wa Nyeri analazimika kusafiri kutoka Nyeri hadi Nairobi kupata dialysis.
Kenyans could also do with the establishment of more health centers
and make healthcare affordable to a common mwananchi.
In the Jubilee report card, how would the Kenyan taxpayer rate the government in the health sector? Is it satisfactory, or are there loopholes? And if so, which are they? 1 year down, 4 more to go for Kenyans to see if the Jubilee government will fulfill the promises laid out in the Jubilee manifesto. Karonderi for KTN in Nyeri.